The heart is the seat of all that we hold dear as human beings.
We first learned that Eden had hypoplastic left heart it was like 20 weeks in pregnancy during our anatomy scan. And probably one of the scariest moments of my life. I knew it would entail a lot, but then also there was that looming possibility that she could die.
Our nurses take them from a state of fear, explaining the procedure. They walk them through that process, keeping them informed every step of the way.
When we are able to provide the most advanced therapies and things like that here, it helps us to get patients who are the most sick through hard times.
I feel like everyone here has really shown that when you have these patients, the whole family is your patient, not just the baby.
Our cardiac program is a great example of the investment in the culture and the vision and the focus on top quality care and creating an environment for those teams so that they can be innovative, so that research can happen, so we can bring in novel therapies, so families have a chance of doing something different that maybe others don't have. We all want to make the difference, even if it's just one child, one time in our life.
So they've built a really, really good team that know what they're doing and truly care.
Even here, in the short time that I've been here, we've done some things here, either myself or combined with our colleagues in the cath lab, where we're able to do things that they hadn't even done here in Jacksonville before.
This staff inspires me every day by what they do, and they do it with a smile on their face. They do it with love in their heart, and this is a passion. This has to be a passion for anybody who works in this area, to take care of these kids and see them sometimes in states that you can't unsee.
We diagnosed Kennedy with a condition called tetralogy of Fallot, which is one of the conditions where we call the babies as having a blue baby heart condition.
When you're in shock at that level, at the emergency nature of everything, and trying to understand the complications of the case in medical terms, you really need somebody to break it down and explain it to you. And Dr. Shinoy and the medical staff at Wolfson's did a fantastic job of that and supporting us all the way through. And we're just extremely grateful for them.
After she was born, we had extensive counseling of the parents about the signs to watch for. Unfortunately, Kennedy contracted a respiratory infection, which pushed her into one of these TED spells. But the parents remembered the counseling sessions to a T, recognized that their child was having a tetralogy spell, and immediately rushed her in to the emergency room.
She's a newborn. Your baby just in front of your eyes, this is happening. But it was just almost like organized chaos where there's so many people doing so many things, and the shots and the wires and this and the this and the medications, but they knew exactly what they were doing.
Our team here in the emergency room and in the cardiac intensive care unit recognized that she was quite ill and immediately put her on a heart-lung machine while her body recovered from the viral illness. And shortly thereafter, she had her complete surgical repair.
When she was in surgery for what ended up being close to 8 hours, those were some of the longest hours of my life. I'll never forget when we debriefed afterwards and heard that everything went well. And it was such a relief to see her again.
Today, Kennedy is thriving. It's a culmination of events over the course of her life that have led us to this happy ending.
Charitable donations and support are just absolutely critical for what we want to accomplish. We're functioning with a goal of providing the same quality care for cardiac surgery and cardiology services that you could get anywhere in the country.
So being able to give that child, that individual, a heart that is functioning to an optimal extent really ensures that they have a lifestyle no different than any of their peers that was not born with a heart defect. And that's what I think makes a heart center such a special place.